Hey everybody, welcome back. I just wanted to give a quick update on the whole breast reconstruction situation. If you've been following along, I did have a prophylactic mastectomy back in February and things have been going really well, and I'm actually getting ready. I'm about 12 hours away from going into my next surgery tomorrow morning. So I just wanted to give kind of a little rundown of how I'm feeling, things I've been doing to prepare for tomorrow, things my family have been doing in hopes that this helps anybody who might be going through a similar situation. So February was the mastectomy with the reconstruction part. So they did it all in one. They did the mastectomy and then they put the implants right away in. It's called direct to implant. I didn't have to wait or do expanders or anything like that. And upon waking up from that surgery, I found out that I was given 520cc implants, which was okay. However, I was expecting about 580. He said that when he got in there were some parts of my skin that did not have good blood flow. And so he didn't want to go too big in fear that my skin might not accept the stretching as well. So because I definitely did not want expanders, he just put in a little bit smaller of an implant. So honestly, when I woke up from that surgery in February, I looked down and I did have a wound vac on. So looking down, everything was already sucked in, but everything looked really, really small. And then when he told me 520, I was like, but also I'm not super picky because the whole point of this is to prevent cancer, but I was expecting a little bit bigger. So at my follow-up with the plastic surgeon, that was a week later, we did notice that one of my implants looked a little lower than the other. It kind of looked like one was droopy and one was high and tight. And he said that sometimes that's normal and it just takes several weeks for them to kind of even out and for the pocket to form, the capsule, I think they call it, around the implant where your body kind of like holds it in there. So we waited and we waited and we waited. And about 3 months later, we realized that Mr. Droopy was not going anywhere. It was significantly lower. And when he looked back in my surgery notes, he did note that during the surgery, he had to remove quite a bit of skin from my high and tight side because of the skin not having good blood flow. And because he removed that skin, it did make the right side much tighter, which in turn makes the left side look droopy. So actually the left side is the normal one, but because there's that difference in the amount of skin, this one does look droopier. And of course, he was not comfortable just randomly removing skin from the other side to even him up. So he just hoped for the best, sewed me up, and sent me on my way. So I was given a choice. I could keep these implants and just go on with my life and not worry about it, which is what I was planning to do. Or I was given the option to go up a size in implants to make not only the breast larger, but also to even them up, because this side is so tight with that skin removal that by putting bigger implants in, it will kind of tighten out this side too and make them look a little more even. And then also he wanted to do fat grafting along with that. And so that would mean that he would take the fat from my lower abdomen and liposuction it out and then inject it up into my breasts to make them look more full. I did not have any fat grafting at all done with my 520s, with the first ones that I had with the mastectomy. And honestly, they look great. I feel like I have no rippling. I don't see any areas where I really need extra fluff, which is kind of where they do that fat grafting to fill in any dents or anything like that. Everything to me looks great, but it's the difference in levels and heights that bothers me. So much so that it's pretty obvious even in a bathing suit. Even though I really did not want to go under for another surgery, I decided that I think it really would improve quality of life. It would improve confidence. And also I don't want to go get my nipple tattoos done until I'm certain and happy with the actual implants themselves. Also keep in mind that my mastectomy scars do go all the way across from center all the way to the out like armpit areas. And so the difference in levels of the breast is even more obvious because you can tell that my incisions are not even. And I feel like that is really going to make things tricky when I do go for my nipple tattoos. So tomorrow is the day. I am 12 hours away from going under for a implant exchange. So they're going to take these 520s out and they are going to put in either 580s or 630s, which sounds like a huge jump, but these are the Mentor Boost brand implants, and there's not many options between the high 500s and the low 600s. So actually I think he did say either 580, 600, or 630. And either way, it will bring me about a cup size or a cup and a half size bigger, which is okay with me, but more importantly, it's going to even things up. He's also going to do a little something called scar revision because he did have to remove some skin from the side of this breast. He's going to kind of just patch things up there. And then he does want to do fat grafting. And even though I told him on our Zoom call recently that I feel like I don't want the fat grafting because it's just an extra recovery piece. You have to wear a binder around your belly. You have to look out for like the lumpiness, and the fat can dissolve too if you're on a weight loss journey, which I kind of am. And so I just didn't want to go through that extra step, especially because I didn't have fat grafting the last time and I feel like everything looks great. But he swears the fat grafting is just going to put the cherry on top. But he's also a plastic surgeon and he is a perfectionist and this is his craft. And so I kind of get his point of view too. So I think what I'm going to do is when I get in there tomorrow morning, I'm just going to tell him, hey, I would prefer for us to not have to do fat grafting, but if you do get in there and you put the new implants in and you feel like, I think fat grafting really will make them look good, then just do it. I'm just gonna put the ball in his court and trust his expertise, and the amount of fat that he said he would take from my lower belly is actually, I think it's like 50 milliliters, something very, very small. So I'm not too concerned. It's not like he's taking a massive amount out as far as the recovery piece goes. He also did say that my little armpit fat that hangs right here, he would lipo that. And that's interesting because the breast, my natural breasts, were very, very low and saggy from breastfeeding 3 children. And so all of my armpit skin and everything was kind of like pulled down. But then when I got these implants in, because they're so much higher than my natural breasts, it's almost like a shelf where the armpit fat hangs over the implant and it's super obvious. So he did say that he would lipo that a little bit. That's also something that I feel like is so minor and cosmetic that I'm not too concerned about it, but great, if he wants to do it, then go for it. Surgery is supposed to be like an hour and a half to 2 hours, which is really short compared to the mastectomy, which was like 3 to 4 hours. And actually the mastectomy was supposed to be like 6 hours. They did mine really quick. So I feel good about that I'm not going to be under for as long. And then the recovery for this one is supposed to be minor. They are not cutting into my mastectomy scars. They're actually going to do a small incision under my breast, pull the old implant out, shove the new implant in, and sew me back up. So the risk of infection is also much lower because I don't have these giant incisions going across, although there still is a risk for infection, which was my biggest concern with my first surgery. I will not be able to lift anything over 5 pounds for a whole nother 6 weeks again, which was awful the first time around because my daughter was 9 months at the time and she wasn't walking yet, and it was awful to not be able to hold her for so long. But now she is fully mobile and walking and moving around, which will make me feel better, but it's also going to be harder on my husband because now he's going to be the one chasing her around everywhere. And also I have my 3-year-old and my 6-year-old who need my attention as well. So no lifting, no driving, no working out, which I have been on a serious fitness journey lately. And so this is probably the worst part mentally, is knowing that I'm going to be sitting around for 6 weeks. I'm really going to try and keep my protein intake up. My trainer said, don't worry about the movement piece, worry about the diet, which is the last thing I want to worry about when I'm recovering from this surgery. But I'm going to try and really be good this time because the first surgery, I lost a massive amount of muscle mass. We use one of those in-body scales that show you your muscle mass and your fat percentage. And I had a lot of muscle mass before my first mastectomy, and then I dropped and increased a lot of body fat as well, which makes sense. So I'm going to try to be kind to myself. I don't want to stress out about it too much, but I think that will be the hardest part of this recovery, is just not being able to work out and keep up with the things that I've been doing. So tonight I have to take my special HibaCleanse shower where I wash my body with that pre-surgical soap and get any bacteria and things off like that. Had to take all the nail polish off my fingers and toes. Of course, no makeup, no lotions, no deodorant, no nothing like that. I'm going to shave my legs because I will not be able to reach down or do any movements like that for a while. My husband has been spending the day, I'm just getting the house ready. We're bringing everything to like lower levels so that I don't have to lift my arms up, because I will have to do the T-Rex arm thing again like I did after my mastectomy. And my daughters will be with my family for tomorrow, and I am supposed to be coming home tomorrow as well. So the surgery is scheduled for 7:15, and I am supposed to be out of there by 12 noon. So, you know, they always say that, and then it always takes forever. So it's not an overnight surgery though, like my mastectomy. So that's really reassuring. My surgeon says that I should not need drains again, which that word "should" really stresses me out, because if I wake up with drains tomorrow and this was just an elective surgery that I didn't really absolutely have to have, like this is just cosmetic, and I have to go another week and a half with drains, I will cry. But he said once he gets in there, you know, if there's a problem with fluid or whatever, of course they're going to put the drains in just to avoid any kind of infection risk, which I understand. I also have to keep reminding myself that this is prophylactic, so I really try not to complain about anything. Like, this is preventative, and I always feel for any women that are going through this that actually do have cancer, and here I am complaining about possibly having drains from an implant exchange. Like, I shouldn't be complaining about that. I should just be grateful that I don't have cancer. So I'm really trying to stay positive. I am not nearly as anxious this time around as I was with the mastectomy. The night before my mastectomy, I was really thinking, like, I'm not gonna wake up from the anesthesia, like, who's gonna take care of my kids? Like, awful, awful, awful thoughts. This time around, I don't know if it's because the first surgery was so successful or because I know I'm going to be under a lot less time and I'm not staying overnight in the hospital this time around. But I actually feel excited. Like, I'm excited to wake up and hopefully see an even matching shelf here instead of one drooping and one high. And I'm also excited to put this all behind me so I can hurry up and get my nipple tattoos and just put the bow on the package. So stay tuned. I will be giving updates. I have tons of, you know, daily updates on my Instagram and my TikToks if you want to go look at those, Wildflower Heart and Home. And then also I will be doing a video that explains my entire journey from start to finish, how I got started with this, the journey throughout, and inserting all my daily update videos throughout that as well. So I hope this was helpful to anybody who's looking into this. If you have any questions at all, please, please, please don't ever hesitate to reach out to me and look out for some updates.